Hello again, I'm Dr. David Beaulieu with more news you can use, and I'd like to talk to you today about vitamin D. Vitamin D is a lot more important than we used to think. For the longest time, what we were told was 400 units of vitamin D is plenty. If you get more than 400 units of vitamin D a day, it could create problems because vitamin D acts very much like a hormone in the human body. You got to be careful. Today, the authorities are recommending somewhere between 2 and 10,000 units a day. It depends on who you listen to. The World Authority on Vitamin D, University of Wisconsin, got a little angry about 10 years ago. They kept trying to get their work published and had great difficulty getting it published in the bigger peer-reviewed journals. So they wrote some books. These MD PhDs who did the research got so much attention from their books that it embarrassed the profession. And pretty soon we started seeing vitamin D research in all the major journals. I'd like to talk to you about some of those journals at this time because some of this latest research, I guess I'd have to say, is significant, and we don't use that word very often. It's a new study published in Cancer Epidemiology, Biomarkers and Prevention. That journal found that low vitamin D significantly increases overall. Low vitamin D increases overall cancer risk significantly. Significantly isn't a word that we use in the medical scientific literature unless the results are almost overwhelming. But they use it here, and they do it for a reason. Another study, Journal of Anti-Cancer Research, says very clearly the more vitamin D you make from sunshine, the lower your chances are of dying from 15 kinds of cancer. Another study, American Journal of Clinical Nutrition, found that vitamin D can lower the chance you'll get cancer by 77%. I said 77%. I guess that's significant. The European Journal of Cancer looked at cancer rates all over the world. Their study says plainly that vitamin D production in the skin decreases the likelihood. That means going out and getting sunshine. I don't care if you're 80 years old and you haven't been out in 20 years. Go on out there and get sunshine on a regular basis. Guys, get your shirt off. Go on out and get some sunshine. It's cancer protective. This is good stuff. What this research showed us was that it reduced the likelihood you'll get any of the following cancers significantly: stomach, colorectal, liver, gallbladder, pancreas, lung. It goes on and on. Breast, prostate, bladder, and kidney cancers. This is significant. Vitamin D may be the best current hope for preventing cancer. So why don't we hear more about this stunningly important news? Modern medicine seems to have very, very little interest in something that isn't going to produce a great deal of income. But this is something you can do supplementally. In our office, we like to use neuromuscular biofeedback, muscle testing to determine exact dosages. I know what I need. In the summer, I don't take any vitamin D at all because I make plenty when I'm out on my sailboat on weekends. But during the winter, I need up to 5,000 and 6,000 units a day for optimum health. You may need that much too. Muscle testing will give us exact dosage. Otherwise, unless you get quite a bit of sun in the summertime all year round, 2, 4, 6,000 units a day is not too much. Vitamin D can lower your family's risk.